We're students from the University of Southampton and we have been asked to conduct a research brief by the Men's Health Forum. This research project focused around two key questions. Firstly, why is it that men are reticent to go to the GP? And secondly, what could be feasible suggestions for improvement?
Men's health is a very important and worrying issue. The fact that men die earlier has made its way into popular understandings of health. Medically, there is no reason for this gap in mortality. Men don't die earlier due to a biological reason. There are root causes and lifestyle choices that contribute to their overall poorer health. Over 630,000 deaths occur in working-age men every year, compared to just 300,000 in women. And not only do men die earlier, men also die of preventable diseases at a far higher rate than women. These are diseases such as skin cancer, which are more likely to affect women, but which men are more likely to die from. The rates of male use of GPs and primary healthcare is on average lower than women and is believed to be a key contributing factor to the poorer health of men all over the UK.
So how did we approach the problem? Well, initially, we began by reviewing secondary research to try and gain a better understanding of the issue. We knew men were less likely to use primary healthcare, but we had no real idea why. So we looked at medical reports, newspapers, and journal articles in order to gain an informed opinion on what might be at the heart of the problem. Using this data, we were in a better position to move forward with our research.
Once we had our initial findings, it was time to move on with the study. We decided that in order to ensure our findings were valid, we would use a mixed method approach to the research question. Each of these methods complement one another, aiding our understanding of men reticent to visit their GPs and allowing us to propose solutions. This gives us several perspectives on an issue that a singular approach might not have. For example, while statistics and surveys can give an important understanding to the scale and distribution of the issue, they often miss out important social and psychological factors that can be better understood with more qualitative research. Now, I'm sure you're on the edge of your seats, so here are the methods we used.
We looked at past interviews and case studies with some background qualitative data. We then looked at surveys such as the 2011 Welsh Health Survey and the 2010 Health Survey of England.
Once we had the initial data, it was time to do some research of our own. We interviewed healthcare professionals as well as members of the general public. We asked them why they thought men were less likely to visit their GP and any possible solutions they feel might be effective. By doing this, we hope to understand the issue better. Were these problems sociological? Did men feel that there was a stigma related to going to the GP? Or was the problem more to do with working hours and time management? Was it simply too inconvenient? By using semi-structured interviews, we were able to keep the respondents on track, while still giving them the freedom to say something that maybe we hadn't expected.
Finally, in our efforts to decide on a feasible and effective solution, we used a comparative case study analysis. We looked at media campaigns that mainly targeted men. Looking at the strengths and weaknesses of targeted and mass media campaigns, we were able to decide on the best way to approach men through this medium.
Now we will discuss exactly what we found and our recommended solutions to get men to take advantage of the primary healthcare services. We'll show you our top 3 solutions. Our first solution is to use targeted advertising in male-oriented locations. This could be near pubs, garages, leisure centres, gyms, or in male magazines. Our research showed that campaigns that were more targeted in terms of placement and language were more effective and more likely to impact on an audience, which in this case males. The use of role models such as sportsmen, celebrities and awareness campaigns has also proven to be quite effective in tackling the stigma associated with various health issues. This is important in this context, as our research has showed that there can be some stigma associated with the use of primary healthcare.
This is a general yearly checkup addressing any issues related to individual health. This system is already used in both the US and Germany and is a good way of ensuring at least annual use of primary healthcare. One idea is to make any benefits received reliant on having a yearly checkup. This ensures a greater success rate, as well as targeting a section of the population we found to be particularly unlikely to use primary healthcare, despite the fact that they are often those with the worst health.
The third solution is more flexible and convenient GP hours as well as locations. We found that often the problem with visiting the GP is that it is seen as inconvenient. This serves to compound background causes such as social stigma and being uncomfortable discussing personal problems with medical professionals. It gives men an excuse, however, it is a general and prominent reason for their lack of use. With more flexible opening hours, this would allow men to go at a time more convenient for them, which wouldn't coincide with working hours. Flexible locations would mean people would not have to go out of their way to visit their GP, therefore saving time.
We hope this has been an eye-opener for many of you. Men's health is an important issue that's too often forgotten about. So don't forget that from the 10th to the 16th of June, the Men's Health Forum is running the annual Men's Health Week. This year's is called You Only Live Once, so talk to someone. The campaign aims to tackle the stigma in men's mental health and promote mental well-being and help seeking in men. 3 out of every 4 people who kill themselves are men, especially young men. So to prevent any future health problems, just think, YOLO.
Now,
Scene 6, take 1.
once we had the initial data, it was time to do some research of our own.